Well, we're celebrating the 5th anniversary of our relationship with the Mayo Clinic Care Network. I really think it's the relationship we've established with Mayo Clinic. We go to leadership programs with them, and we see how they do their processes. So we have changed how we deliver care because of that relationship. And I think that's been very beneficial for Stormont Vail, beneficial for our patients, and ultimately beneficial for our community.
Our relationship with Stormont Vail over the last years has been fantastic. It's really been an exemplary relationship. We have shared expertise, educational themes, we've collaborated with research and administrative processes, and we have literally cared for 1,000 patients together.
So membership in the Mayo Clinic Care Network has allowed us to keep some of those patients here, deliver their care here, and deliver the same kind of care that Mayo Clinic would in Rochester or elsewhere. It's meant that we have advanced in our care model through collaborations with Mayo Clinic. Probably our patients benefit the most from our ability to tap into the resources at Mayo Clinic to provide eConsults, the opportunity to receive the care they need here at home in Topeka.
The eConsult brings an entire scope of expertise which is seldom found in a large community hospital such as Stormont Vail. We're able to bring to the patient within their community a world-class level of care that they would otherwise have to access through a trip, through travel.
An eConsult is when we ask a particular question of a Mayo specialist in a given field, and we send excerpts from the patient's record, and we send all of the imaging studies through the cloud to Mayo, PACS to PACS, and with that information, once the pathologist has read it up there, then one of the specialists will look at the eConsult, and usually in about 2 days we'll have an answer back. As of today, we've completed 1,037 Mayo eConsults, and we started April the 1st of 2014.
Not every patient, especially the cancer patients, are very sick and they cannot travel all over the country to seek state-of-the-art care. So it's very important to provide that state-of-the-art care right at their doorstep. So it saves them a lot of financial toxicity as well as their hassle to travel long distances to seek these opinions. And majority of time, I will say over 90% of time, these patients can be taken care of over here.
Stormont Vail Health participated in the Mayo Collaborative on reducing readmissions for COPD. We were one of 13 other members within the network that all participated to share best practices for reducing readmissions. The Mayo Clinic Network had what they identified as their best practices, but they really encouraged a lot of sharing among the other team members in the network, and we all discussed and what we could learn from each other with the goal of improving our care towards COPD patients and reducing readmissions.
When I trained in Mayo, and I learned that there are other aspects or other approaches to treating patients and having them heal faster and get to work and to life, to their daily life faster. We actually reached out to Mayo and went there, a group of us from a couple of surgeons, a few nurses from the hospital, went up to Mayo, learned that approach, that protocol, and brought it to us, to Stormont Vail, and we started implementing it. And we saw a huge difference in how patients actually felt after these major surgeries. Instead of staying 10 days in the hospital, they're leaving within 4 days with no pain, and they're doing better and going back to their daily life and daily activities faster.
So for a very long time here at Stormont Vail, over the last 20 years, we've developed a leadership model where a business administrator is coupled with a medical director. By coupling together a clinical administrator who is a clinician and a business administrator with business acumen, we're able to bring that leadership group together and make a stronger, more cohesive leadership dyad.
I went to a 3-day dyad leadership conference with Dr. Sarah Sarton. She is the emergency department medical director, and her and I had the opportunity to collaborate, to be able to challenge each other, to evaluate where we were as a department and as an organization, and to be able to connect with other Mayo Care Network affiliates and to be able to share ideas and support one another on that dyad leadership.
Some of the many aspects that we brought home from the Mayo Clinical Care Network leadership training were advanced collaboration between physicians, administration, and other teams in the hospital, as well as new advances in our patient experience and our patient-centered care. The most important thing that I brought home for the Mayo Clinical Care Network leadership training was the importance of relationships. The relationship between a patient and provider, the relationship between providers and administrators, and also the relationships between us and other care networks such as Mayo Clinic. These relationships and building upon those, I think, can greatly impact the quality of care that we can provide here at Stormont Vail Health.
One of the tremendous advantages of the membership in the network has been it has assisted us in the recruitment of outstanding providers, whether they're relocating from other practices or coming straight out of training programs. And I would say especially individuals that are still in training programs have a high level of knowledge of the Mayo Clinic wherever they have trained. And they're very interested that we have that opportunity for them to collaborate with specialists at another geographic location, especially an eminent place like the Mayo Clinic.
Well, I think it's a great recruitment to our students, especially who are out there, think that it's wonderful that they have yet another peer that they can go to. We are constantly building on our mentoring and retention programs, and this is just like having another mentor in your pocket.
One of the biggest benefits we've had from the Mayo Clinic Care Network has been their consulting services. There have been a lot of changes that have occurred because of the consultation services that we have been able to tap into at Mayo. We have had several of our management team and others in the trenches be able to connect with other network members and Mayo directly, whether it be policy exchange, it be to come and observe how we're doing a treatment or procedure, to learn what other methodologies or resources might be out there for us. So there are so many people that have tapped into these consultation services.
When we looked at where people thought they could get the best care and had the most brand reputation, and we did this 5 years ago when we looked at joining, it was the Mayo Clinic. We asked people, if you go to anywhere in the world to get your care that you can't get locally, where would you go? And 62% of the population we serve said, I'd go to the Mayo Clinic.
So in essence, we're collaborating. We're collaborating on the care of patients, keeping patients at home, keeping patients at the center of all that we do.
Boy, it's really hard to know where this collaboration is heading in the next 5 years. It has been so beneficial the first 5 years. The sky's the limit.